My dad was not just my father, but he was the heartbeat of the community I grew up in. He was a city bus driver in Seattle, kind of a Black Panther meets patron saint of the community. He was militant, yet gentle, tirelessly endured and helping people with what they needed. When you got on my dad's bus, you knew you were being taken care of. He knew everyone, which was really embarrassing as a child, by the way. He never judged, and his sudden departure in my life was more than just losing a loved one. It marked the end of an era, a huge turning point and shift in my life. But his life birthed something very incredible, a movement, really. And that's kind of what I'm here to talk to you about today. The cost of systems change, which if you're in healthcare like I am, we talk about all the time. Time, cost over time over cost. But the real cost of system change is sometimes really prompted by unexpected people, events, conditions, and yes, time. 5 years ago, I started a nonprofit birthed out of my pain, my lived experience, and the reality that time is super short. And it feels different when time goes from meaningful to meaningless. 1,826 days. It's a long time. And at the time of my dad's passing, shockingly, I was knee-deep in my career as a hospital leader. I ran hospitals for a little bit over 13 years in Northern California. And so I was navigating healthcare system daily. I knew this system inside and out, inside those four walls. But it was my father's death and his life that made me really re-examine everything I thought I knew about time. I remember the day where I realized how many people relied on my dad keeping their time. He was a timekeeper, right? Bus schedules are a little bit like clockwork, and they were in his control. And there I was, 1,000 miles away. I was a time broker. I negotiated with clinicians about time, how much time they were spending with patients, dealt with all the stacks of complaints about how much more time people needed. I thought about wayfinding, how much time it takes for you to get from the ER to the cafeteria. But in facing a system of time, really neither one of us truly understood. A different time journey. You see, there is a journey that millions and millions of Americans are on every day, and their time is valued differently. It's not about navigating the complexities of the healthcare system. It's about the time that's lost. The lives that are changed in those seconds, and the degradation of how we treat their time versus our time. Waiting for change to happen. The time in line at the pharmacy, right? For you to get all the way up to the front and them to tell you that they don't take your insurance. But you're on the largest insurance program in the entire country. We're going to delve into this journey. We're going to all learn a little bit more about how time for some people is valued so much differently than time for others, and the profound impact on when system change unfolds over generations. There, in fact, Medicaid is 58 years old, have been generations of people devalued through this time. A generational curse of time? This journey is really pivotal for us to be on, not just in unlocking human potential, but for creating a more compassionate meantime for all of us. How many of us have said, like, in the meantime, right? I say it all the time, in the meantime. But what if mean time was really mean to you? I'm going to have you guys take a journey with me. We're going to get on my father's bus. And this time when we were on a bus, I'm sure many of you guys haven't taken a bus in a while, but if you have, think about the people on the bus, not as people, but as their stories. Their stories of resilience and hope and struggle. And think about how these are the people we devalue in time every day. But I think we can change mean, right? And make mean time, or in the meantime, meaningful time. As we go about our days, it's easy to overlook this, right? We're all busy with our own lives, our own concerns. But I want us to start to pause and think about the millions of people who are spending hours, days, years trying to access the care that they actually deserve. So when we think about being mean, the system can be a bit like a bully. It's a system that prioritizes bureaucracy over compassion, paperwork over people, and inefficiency over empathy. It's a system that treats individuals as mere numbers, waiting endlessly to feel potentially disrespected, disappointed, disregarded. But that's a system. We are people. We can actually change this. We can learn a little bit more about the 94 million people on Medicaid, 87 million of which are adults, and how we value people's time and the impact on time on their lives. This isn't a Medicaid problem, just to be clear. This is a humanity problem. It's a question of compassion and respect for everyone's time, regardless of their circumstances. So how do we move from being mean to being meaningful? We have to address the systems that demand sacrifices of people that are already facing undaunting and significant challenges. We need to make things more efficient, not just for one or two of us, but for all of us. And really think about when we're making lives better, we're making everyone's life better. All right, I had you guys get on the bus with me before. Let's think about how we transform everyone's time. Seeing people for who they are, valuing people's time, streamlining those processes, minimizing waiting, maximizing the care that we get. One thing that struck me back here is when I was talking about all the incredible, the poets and the doulas and all of the systems of care. Not everyone gets that, or anything even close to that. How can we change this system that values time differently and actually creates some people to die? Right? All right, this isn't a pipe dream, and I'm not here to depress you. I know I'm like the second speaker, not to depress you. This is totally within our grasp. We have the power to redefine how we approach time and how we approach other people's time in our time transfer. I told you my dad was a timekeeper. I used to be a time broker. I think all of us have the ability to transfer time and do that in a meaningful way, right? We can transform the systems that we work in, live in. We can be more compassionate ourselves. And then we can make sure that there's a mean time that's not lost or cherished, right? 1,826 days, 43,800 hours. As of last week, that is the amount of time I dedicated to my nonprofit organization, Health Tech for Medicaid. And every ounce of that time has been worth it. To rethink about how we can fix our systems, our journeys, our walks for more than just ourselves or the people that we're caring for, our children, our community. My time isn't me time. Your time isn't you time. It's us time. How can we redefine that? So yes, in the past 5 years, I've been robbed of having my father's time, but I've traded that in for the most meaningful time. Putting meaning behind people whose lives haven't really necessarily always had a lot of value. Showing up for people. Telling people I love them. Saying yes when I didn't really think I had time. Who has time to take 5 years out of your career and your life? I did. Taking that time to change the lives of 94 million people and valuing their time and keeping their voice in rooms that they often wouldn't be in, that time is worth it. So let's think about how we think about time differently. We say that time is money, right? But I think we might want to redefine what that means. Let's think about more meaningful us time. So this journey that we've been on for the last, 14 minutes or so, as this clock is telling me, allows us to really step into today thinking about time, not just for ourselves, not just for our children or our parents or our patients or our consumers, but to really start to think about how our time can deeply bring more time to someone else. Thank you.